Hi Diane, how are you?
I'm fine.
Good to see you again.
Yes, thank you.
How are you feeling this morning?
A little bit nervous.
Right, okay. Well, you'll be fine. I can assure you, you'll be absolutely fine when we leave here. Right, you know why you're here today?
Yes.
Right. Any questions? We talked about this operation before,
Yeah.
but is there anything you'd like to ask me based on what I said before?
I don't think so.
Right, okay.
No, you were fairly comprehensive. So.
Right, okay.
Okay, Harris, can you just run through a few little questions with me just to kind of clarify a few things? Can we start off by explaining what are eye bags and what causes them?
The eyeball is resting on a hammock, right? And there's a lot of cushioning around the eyeball to protect it, basically. And there are curtains in front of the eyeball to protect it. Eye is a very vital organ, as we all know. And there's a lot of protection going on there. Now we have fat underneath that hammock, and there's fat above that eyeball, and it's kind of cushioning it. And there's a curtain in front of it, which is the lower eyelid, and there's a curtain on the top, which is the upper eyelid. Now what's happening is this curtain is actually holding the fat in place, so that is cushioning the eyeball. So what happens with time, the curtain that is holding the fat in place and keeping the hammock secure and safe is becoming loose. As you know, with time, things become loose, skin sags and everything. The same thing is happening to that curtain. It's just coming forwards, and the fat is kind of pushing it forwards and it's popping out, basically. And that's what the bags are.
So if somebody comes in for this procedure, what can they expect?
Well, the first thing is local anesthetic procedure. They'll be awake during the procedure, but we do everything to make sure that they're calm on the day. We have music and so on and so forth on the day to just relax them. It is local anesthetic. They do have an injection on the lower eyelid. It's like a bee sting.
Right.
And then they're awake, we're chatting away and things during the procedure. They'll feel us touching there, but anything sharp or painful they should feel. When the procedure finishes, they will have some tightness there, they will have some swelling and bruising there. We ask them to put some ice packs there post-op. We ask them to keep sitting up, for example, keep the head propped up.
Yeah.
Those sort of things. And also we do some laser treatment just to help with the healing process. At times we give them vitamin K creams to help with the bruising.
Yeah.
There will be some discomfort there, but it shouldn't be painful.
Painful, no.
We also give antibiotics just to make sure that there is no risk of infection there. So it is going to be uncomfortable,
Yeah.
but it shouldn't be unbearably painful. I mean, if it's painful, you should be all right with some paracetamol, but
Yeah.
you shouldn't need anything stronger than that.
Yes.
The first week, patients usually have swelling and some bruising. It begins to get better after about 3 or 4 days' time.
Right.
It should be more or less settled in a week's time. In 2 weeks' time, it should be completely settled. There should be
Right.
hardly any bruising there. There might be a little bit of swelling or puffiness there. After 2 weeks, you're back to normal.